How should I prepare for the worst-case scenario? This epidemic is unpredictable, and it is possible that it could begin spreading in your community. That might lead to problems in the supply chain of various foods and goods, such as masks. It might also mean that local authorities will recommend social distancing measures, asking that you spend more time at home as events and gatherings get cancelled. Schools may close down for periods to try to stop disease spread. Employers may recommend working from home when possible, and healthcare providers may push the use of telehealth services. In the event you get sick with COVID-19, you will likely face a 2-week isolation period at home, unless your illness becomes severe and you require medical care at a hospital. Experts suggest that if you haven't already, go ahead and start putting together an emergency stash of food and supplies for these scenarios, but do not panic buy and do not hoard. Just pick up a few extra items on your routine shopping trips that will help make sure you don't run out of food if you're stuck in your house for 2 weeks. Stick with shelf-stable items that you'll use regardless of how this epidemic plays out. Things like dried pasta, canned foods, beans, lentils, peanut butter, trail mix, nuts, shelf-stable or powdered milk, coffee, cereal, cooking oil, and other grains. Since it's unlikely that we will lose power or municipal water, it's probably safe to stock up on some frozen items you normally eat, and you can skip buying a lot of bottled water. In addition to food, you should think about having some extra supplies of home goods and medicines on hand. If you take prescription medications, try to have extra doses, though this can be difficult to do. Keep your home comfortably stocked with things like toilet paper, tissues, diapers, soap, cleaning products and sanitizers, pet foods, and feminine products. Again, don't hoard. Just buy a bit extra in case you need to skip a routine shopping trip or two. If things look like they're going to get really bad in terms of supply chain issues, you can dash out in the 11th hour to pick up whatever dairy, produce, meat, or baked goods you can get. The CDC has a detailed list of other items to keep on hand in general emergencies. Should I keep anything in my medicine cabinet for COVID-19? With most mild to moderate cases involving non-specific, flu-like symptoms, you may want to make sure you have enough fever reducer pain reliever, such as ibuprofen or acetaminophen. You might also want to consider keeping over-the-counter treatments for colds around. Just because it's that season, upper respiratory symptoms like productive coughs and nasal congestion were not common symptoms of COVID-19, but they are sometimes present. Otherwise, there aren't specific treatments. Can capital X home remedy or product prevent, treat, or cure COVID-19? New, the 3rd of November 2020, a word of caution about misinformation and fraudulent claims. Further reading FDA, FTC slams 7 companies selling bogus COVID-19 cures. Like any pressing health topic, there will be plenty of people attempting to exploit the situation for personal gain, whether it be money or status, particularly on social media. The internet is rife with false information about SARS-CoV-2 and COVID-19 as well as bogus products and strategies to combat them. This will likely intensify as the pandemic escalates in the United States. As the FDA noted in an enforcement action this week, there are currently no vaccines or drugs approved to treat or prevent COVID-19. Although there are investigational COVID-19 vaccines and treatments under development, these investigational products are in the early stages of product development and have not yet been fully tested for safety or effectiveness, the agency says. So, no, eating lots of garlic and huffing essential oils won't ward off COVID-19. Spraying colloidal silver up your nose won't stop SARS-CoV-2 from invading. Getting vaccines that protect against other pathogens, such as the influenza virus or bacteria that cause pneumonia, such as Streptococcus pneumoniae, pneumococcus, are also not going to prevent COVID-19. For more examples, the WHO has a site dedicated to myth-busting. These fraudulent claims waste money, give people a false sense of security, delay actual medical care and treatments, and can sometimes be outright dangerous. Should I go to a doctor if I think I have COVID-19? If you believe you have COVID-19, the CDC advises you should call your healthcare provider. Do not make an unannounced office visit. Your healthcare provider, with the help of your state's health department and the CDC, can determine if you should come in and get tested. Obvious reasons to test include the presence of COVID-19-like symptoms, having had contact with someone known to be infected, living in a place where transmission is occurring, or if you have recently traveled to a place where transmission is occurring. If you do have COVID-19, getting tested can help local health departments track the virus spread and identify contacts who may have also been exposed. Once your case is confirmed, your healthcare provider and local health department can work with you to monitor and manage your health and assess when you're no longer at risk of spreading the infection. But it's important that you call ahead before going to a healthcare provider if you're concerned you have COVID-19. This will help determine if you can and should be tested and provide your healthcare provider with a chance to prepare the office so you will not potentially expose people in the facility or patients in the waiting room to the virus. If a healthcare provider has you come in for a test, the CDC recommends wearing a mask and, as always, practicing good hygiene. When should I seek emergency care? If you have a confirmed case of COVID-19 or if you have a suspected case and your condition worsens and you have trouble breathing, call your doctor immediately to seek prompt medical care. If your condition becomes an emergency, call 911 and inform them that you may have COVID-19. Wear a mask if possible when emergency responders arrive. Is the US healthcare system ready for this? As experts at the WHO have repeatedly warned, COVID-19 can put enormous strain on healthcare systems. For weeks, they have been advising for countries to get ready and have a plan. So far, there have been worrying signs that the US healthcare system has not heeded this warning. Last week, news broke of a whistleblower allegation that the Department of Health and Human Services sent dozens of untrained employees without protective gear to help manage repatriated citizens at high risk of COVID-19 and under quarantine. On March 5, the New York Times reported that nurses in Washington and California, where SARS-CoV-2 is circulating in some communities, have had to beg for masks and have been pulled from quarantines to treat patients. In a survey of more than 6,500 nurses in 48 states by National Nurses United, a nationwide union of nurses, only 29% reported that their hospitals had plans in place to isolate possible COVID-19 cases. Only 44% said their employer had provided them with guidance on how to respond to potential COVID-19 cases, and only 63% said they had access to N95 respirators. There have also been anecdotal reports from Washington and California of people trying to get tested for the virus but being told that there were no tests available. What are the problems with testing in the US? Testing for COVID-19 in the US has been a tragic debacle. The CDC was tasked with coming up with a diagnostic test to detect SARS-CoV-2 in respiratory samples from patients. The agency developed an RT-PCR test for the new virus and sent testing kits beginning in early February to states. But, as the agency notes on its website, shortly thereafter performance issues were identified related to a problem in the manufacturing of one of the reagents, which led to laboratories not being able to verify the test performance. While the CDC has been mum about what exactly went wrong, a report in Science suggests that the problem was with a negative control in the kit, a sample designed to produce a negative test result. Should that control return a positive result, it would render test results uninterpretable, since there's no way of knowing if positive results are actually due to the presence of the virus. A report in Axios suggests that the problem may have been due to contamination. The problem took the agency weeks to resolve, and many states weren't able to ramp up testing until the end of February and start of March. This has not gone as smoothly as we would have liked, Dr. Nancy Messonnier, director of the CDC's National Center for Immunization and Respiratory Diseases, said in a press briefing February 28. The testing snag cost the country precious time in detecting imported cases, isolating them, and tracing their contacts, critical steps needed to contain the virus. Now, in early March, things are improving. The CDC has worked out the problem with its tests. The FDA has loosened regulations on who can design their own tests, and commercial tests are coming online to provide additional kits to states. Unsurprisingly, in the first few days of increased testing capacity, the number of confirmed cases in the US exploded.